Valley Talk on News Talk 1580 KGAL.
Welcome to Valley Talk, another beautiful day here in the Mid-Willamette Valley. You know, this is why we live here. It is absolutely gorgeous out there. Healthy weather. It's healthy to get some sun, not too much sun, but that's for another show. Skin Talk will be coming up next month, second Thursday of the month, right here on Valley Talk. I'm Dave Adams. Glad you're with us today. Don't forget to sign up for Quiznos Taste on Us. Delicious way to have lunch. You can sign up for a $10 gift certificate. We give away that every day during the show. You can simply email me, Dave, at KGAL.com, or call the station at 451-KGAL, 926-KGAL. Get your name into the drawing. And at the end of this show, we are going to be giving away another $10 gift certificate. Could be giving away to you. So thank you for listening to Valley Talk, and good luck with that Quiznos Taste on Us. Thanks to Dale and the crew for being a big part of the Valley Talk family. Another thing that we're working on here with Bertram's Metals and others is Honor Flight One Last Mission. Now, this is an amazing, amazing documentary. Honor Flight is a program that takes World War II veterans from all over the country and flies them back at no expense to the veteran to see the World War II National Memorial in Washington, D.C. You need to remember that a lot of these World War II veterans are in their mid-80s, mid-90s. We're losing 1,000 of them every day. And there's a real push to get especially the veterans, the World War II veterans, who cannot afford to go back to D.C. to see the National World War II Memorial. Now, this is really important, that they see for themselves the honor and the thanks that the grateful nation has given to them in going back to the World War II Memorial. What is it like to go back to the World War II Memorial for one of these World War II veterans? That's what Honor Flight One Last Mission does a great way of telling. They follow 4 veterans back to D.C. They've made a documentary. We're going to be showing that documentary at 2 showings here in the Mid-Willamette Valley. On Armed Forces Day, May 18th at 1 p.m. at the Pix Theater in downtown Albany, and May 25th at 1 p.m. at the River Center in Lebanon. Now, tickets are only $10 each. You can buy tickets right now from Bertram's Metals. In fact, all 3 locations as of today have the tickets. Bertram's Metals has tickets for both the Albany and Lebanon showings. The Pix Theater in Albany has tickets for the Albany showing, which again is May 18th, 1 p.m. And the Lebanon Chamber of Commerce has tickets for the May 25th event in Lebanon. Tickets are $10 each. All of the proceeds from the ticket sales will go to helping ensure, if we sell these tickets, we'll be able to send 10 veterans from the Mid-Willamette Valley on an honor flight back to Washington, D.C. So it's a fundraiser for Honor Flight, and it's a chance for you to pay respect to the veterans and just see what the world's greatest generation did in securing freedom for us back in 1941 and back during World War II. Check it out online. Go to honorflightthemovie.com. Again, 100% of proceeds benefit the Honor Flight program. Thanks to Bertram's Metals, KGAL Radio, the Pix Theater, Lebanon Chamber of Commerce for helping make this possible. But the people that are really going to make this possible are you. And we ask that you get involved and go see this movie. Buy a ticket. They're only $10 each. And support the veterans and be a part of the Honor Flight family. Again, go to the movie. Go to the website, which is honorflightthemovie.com. Check out the trailer. Thank you very much for doing that, or considering doing that. Today, health is going to be the topic of Valley Talk. And in the studio right now, we have Mike Huntington. He is with Healthcare for All Oregonians. Mike, thank you for being with us in the studios.
Thank you, Dave.
Now, Mike has an interesting perspective here because he's worked in the healthcare industry as a radiological oncologist.
That's right.
And the second half of the show, we're going to have Dr. Tim Hindmarsh, who's going to be in the studios. He's been a general practitioner for 20 years. His message that he's trying to get across is we need to get off the couch and we need to eat better. And if we do, we're going to be a lot healthier. And that's part of what we're going to be talking about during the first part of the show. So healthcare is going to be the topic of Valley Talk today. Mike, thank you for being with us on the program.
You're welcome.
Healthcare for All of Oregonians is an organization, and what are you trying to do?
Healthcare for All Oregon is a coalition of 62 organizations, some are church groups, some are unions, some are business groups, all with the intent that every Oregonian deserves health care, and that we have the ability as members of this state to make it happen. We tell our legislators what we need, and they are responsible for providing that to us. And we need health care.
We do need health care, and you and I were talking before we went on the air, and it's kind of a sad state because right now in the United States, we've probably got some of the most advanced health care on the planet, but there are people right now here in this country that are dying because they can't get access to health care.
That's right. There are 45,000 people, Americans, each year who die because they do not have access to health care. Other civilized, developed countries do not let that happen. No one dies in Canada or the European countries that have good healthcare systems because they don't have health insurance. This is the leading wealthy country that systematically excludes people from access to healthcare.
So at times we get kind of in a political discussion here. Is healthcare a right? Is it a privilege? Should we pay for healthcare for all people, even those who abuse it? And in fact, I may express my personal belief here is that we need to help each other. And as a country, I think we'll be stronger as a nation if we're healthier.
Definitely. Whether you call it a right or whether you think of it as that we're all better off when each of us has access to health care, it doesn't matter to me. I think the main phrase we would want everyone to know is that every Oregonian deserves health care. The opposite of that is who doesn't deserve health care. And you can find many reasons, selfish reasons, that all of us should have access to health care. Do you want people harvesting and handling your food who don't have access to health care? Do you want children sitting next to your children, grandchildren, who don't have access to health care? There's selfish reasons. Do you want our economy to suffer compared to other economies because we pay twice as much as other countries for health care and get less value? So there's economic reasons, selfish economic reasons. But the main one is the one you alluded to, which is we should take care of each other. And Americans are compassionate. We just haven't been able to figure out how to do it with our legislation.
There are some with a conservative view that say, I don't want to pay for everybody's health care, especially those that abuse the system. And maybe they're smoking, maybe they're eating, maybe they weigh 300 pounds. If you weigh 300 pounds, this is not a derogatory statement to you, but you're essentially not taking care of yourself. And there are those of the conservative community that say, why should I pay for their health care? And also, as we look at the healthcare system in the United States, are we getting the best bang for our buck? I don't think we are.
No. So answering the first question about should we pay for that person who doesn't take care of themselves? Well, we can say, let's not take care of those people. And what happens?
They'd probably die.
They die, or they come to the emergency room, and we have a decision then of letting them die on the ambulance ramp, which I don't think this country is ready to do. We can also point out that 80% of the healthcare costs are generated by 20% of the population. People who have pre-existing conditions, diabetes, hypertension, and obesity, for example. And so how do you take care of that 20% so that they don't get into trouble and unnecessary suffering and cost for the nation? Well, you take better care of them. That's how you do it. You emphasize preventative care. You emphasize access to primary care. And we can do that. We can legislate that. But in the way right now are too many of us who consider healthcare a commodity, and we earn our incomes by that. And when we focus on healthcare as a source of income, we forget that it's a service, just like fire protection, police protection, that we all need just to get by.
What's going on now? First of all, what does healthcare for all of Oregon do? Do you lobby legislators? Are you trying to educate the public about healthcare and what needs to happen?
Well, our main goal is to educate the public. And I think anyone who has a hard time getting insurance right now or has a high deductible plan and still can't afford health care because of that, or you're a business person and you're struggling to provide health care for your employees and you really want to, but you can't because it's so expensive. Individual policies now cost $15,000 a year. That's unaffordable, and it's unaffordable for businesses. Or if you simply think it's unfair that some people don't get health care, if you agree with any of those, you can help by joining a group like Healthcare for All Oregon. Locally, it's Mid-Valley Healthcare Advocates. There's an Albany chapter of Healthcare for All Oregon also, and you can find how to join by going to healthcareforalloregon.org. And there is also a Mid-Valley Healthcareadvocates.org website that we invite you to go to.
So is your group also part of the discussion in finding answers?
Yes. The Healthcare for All Oregon Education Fund focuses on staying current with the research that is available that points out how flawed our system is and still will be even after full implementation of the Patient Protection and Affordable Care Act, also known as Obamacare. And even with the good effects of that law and Oregon's coordinated care organizations, there will still be millions of people across the nation and hundreds of thousands of people in Oregon left without adequate health care. So we need more than these recent laws that have been passed.
Without getting overtly political, Obamacare, do you feel it's a good step?
I think it is for several reasons, in spite of its flaws. The first reason I think it's important is that it honors the idea that every American deserves health care, and it's in our best interests for that to happen. It emphasizes primary care, which is very important. That's the main link for people to get good health care is through primary care. It also, as you may know, it allows young adults to stay on their parents' policies if their parents have insurance through age 26. Many good features. It prevents you from being denied insurance because you have a pre-existing condition. So there are many good things, but this is all made unstable by the underpinning of the market-driven aspect. That is, if I, as a insurance company, am going to succeed, I have to avoid risk. And that means avoid signing on patients that might cost me money. That's no way to provide health care for a nation, to have a system based on that kind of private insurance where profit takes precedence over service.
So what are you proposing? You're proposing socialized medicine or a national health care where the government takes the role of being the doctor?
I think that's a misconception that if government takes any role at all, does it have to take over? No. What government can do is represent us, the people, in bringing us what we need. We do that all the time. We tell government we need fire protection, we need police protection, we need public utilities, we need public health, and government does that to us, for us. Healthcare is the same thing. We've already talked about why we all need it, and we all benefit when everybody has it. It's just a matter of how do you deliver that. So I would say what we're after is the public directing how money is spent for healthcare, not CEOs of insurance companies, not stockholders, but the people. And you have to believe in yourself that you can make government do what you want it to do.
So, okay, technically and the mechanics, how do we do that? Right now, the insurance companies, and you don't like the profit model of how healthcare is being provided. How do we put the people more in control without having the government take over, which I've got a lot of questions here, but let's take that one first.
Well, first thing that comes to mind is what power do you give the people versus someone who's in the business for profit? And right now, we have not allowed our healthcare system, namely Medicare, to even bargain with the pharmaceutical industry on price. We have many other situations where the public is not well represented when it comes to getting health care provided for everybody. So what we have in Oregon now is a bill, HB 2922, which is for a publicly funded system of privately delivered health care that would give the public those rights to bargain for price. Other countries do this. And you bargain so that you have healthcare providers willing to stay in the business and pharmaceutical industry willing to stay in the business, but we eliminate the overpricing of these services. That's what we can do with a bill like 2922.
What are the chances of getting that through?
Probably not very high this year, but there is another bill which will help us get closer, and that's House Bill 3260, which would direct the legislature to conduct a study of several types of healthcare financing systems, including a publicly funded system that we were just talking about, sometimes called single payer. But it would compare that to the status quo, which would include Obamacare and the coordinated care organizations. It would include an option for a public or private system. And a fourth option would be a state sales tax dedicated fund to pay for health insurance premiums. So those four options are being considered as a study, and other states have done this and found that a single-payer system saves billions of dollars for each state. We expect that the same thing would be found here.
One of the criticisms of we can call it Obamacare, is that starting, I believe, next year, if you don't have some kind of medical insurance that you are paying for, then you have to pay a penalty. There are some people that are saying it's not right for the government to force you. You either get health insurance, and if you don't, we're going to tax you because you haven't. And let's say, for example, one of the things we've discussed here is the fact that with the profit-driven system we now have, as insurance companies are forced to take on everybody, irregardless of pre-existing conditions, what if the price of the insurance policies goes up? Because all of a sudden the insurance companies have to cover everybody, and so their risk is higher. One would think that because they're taking everybody, that they'll have a larger pool and would spread the risk over. But let's say, for sake of this discussion, that their risk overall is higher. Mm-hmm. The rates go up. And so the poor consumer is left with the question, do I just pay the penalty, which I believe a lot of people will do, or am I forced to pay this higher insurance? Mm-hmm. And a lot of people are very objecting strenuously to this, feeling like they have a gun put to their head by the government saying, you're going to pay for health care without fixing the system first.
I agree that it is unfair to expect people or demand that they pay a price for a private product that is unreliable. And my view is that private health insurance is unreliable. And so for that reason, I can understand those complaints. What I would propose as an alternative is to start with Medicare, improve it so that it has less problems than it does now, but then extend that to all Americans, from birth to death. That would be a way to do this. I don't think we have to force people to buy a private, flawed product.
Could the Medicare system handle that?
We can make changes that would allow Medicare to handle this. As I mentioned, Medicare currently is barred from negotiating price with the pharmaceutical industry. And we can legislate, we can make our representatives say the public needs to negotiate price with the pharmaceutical industry, with healthcare providers, with hospitals. Other countries have figured this out. We can too.
We are talking right now to Mike Huntington with Healthcare for All of Oregon, right here on Valley Talk. We're going to take a break and continue this discussion in just a moment.
When you look out across the Willamette Valley, you'll see plenty of banking choices. Willamette Community Bank is here to give you an option that's pretty unique, like no other, in fact. Hi, this is Sue Kalina, Relationship Manager. Willamette Community Bank provides an alternative to large national and regional banks by offering customized financial services and local decision-making to benefit local people, local families, and local businesses. How many banks can say that?
Willamette Community Bank, service like no other. Member FDIC, Equal Housing Lender.
Albany's Mennonite Home is pleased to have earned a perfect score from the State of Oregon surveyors, making Mennonite Home one of the top skilled nursing and rehabilitation facilities in Oregon, providing the highest possible quality of care. As part of the Mennonite Village Retirement Community, Mennonite Home provides the rehabilitation and therapy services for people of all faiths transitioning from a hospital stay to home. They work directly with each resident's health care, pharmacy, and insurance providers, making life easier for residents and their families. A wide range of resident programs are offered to meet individual interests, including outdoor gardening, scenic walks, cooking and baking, art and music, pet therapy, and brain fitness activities. Mennonite Home is where you'll find superior standards and amazing levels of devotion. The proof is in their reputation and resident satisfaction. Rooms are currently available. Call Geraldine at 541-928-7232 or visit MennoniteHome.com.
Come to Albany's annual Wine Walk, Friday, May 3rd. Stroll historic downtown and sample award-winning wines. Buy your ticket in advance at the Albany Visitors Association or on the night at the Flynn Block or the Carousel Museum. Tour the apartments and office spaces on the upstairs downtown loft tour. Wine Walk is sponsored in part by Albany Rotary, the Downtown Association, Central Willamette Community Credit Union, and Pacific Power. Proceeds benefit local community and international Rotary projects. Wine Walk, Friday, May 3rd from 4 to 8 p.m.
Need a new bedroom addition or patio cover? Make it easy on yourself by including Fitzpatrick Painting in your plans. Fitzpatrick's new carpentry division has already become the talk of the valley, and you'll know why when you see the results. Kitchen and bathroom remodels, dry rot repair, siding, windows and doors, decks, tile, fences, cabinetry, even finish work, you name it, Fitzpatrick's carpentry division can do it.
Fitzpatrick Painting, unsurpassed in customer service and quality.
You depend on your car and you depend on your mechanic to keep that car running right. Depend on Waukoma Auto and Radiator Service. Over 70 years of combined experience repairing and servicing all late model cars. ASE certified master technicians Chuck, Bill, and Wally are TechNet professionals, offering the latest computer diagnostics, affordable rates, and a nationwide warranty on all parts. Waukoma Auto and Radiator Repair is in Corvallis on Cornell, just off 9th Street down from the Goodwill. You can depend on Waukoma.
Less hype, just quality news, sports, and smart talk. From your friends at 1580 KGAL.
Welcome back to Valley Talk. I'm Dave Adams. Healthcare is the topic of the show today. We've been talking to Mike Huntington with Healthcare for All of Oregon, talking about the need to fix the system, that it's broken. There are people that need access to healthcare that aren't getting it, and some of the ideas that they're putting on the table to try to make that happen. Dr. Tim Hindmarsh has been a private practitioner for 20 years. Has just joined us and will be talking to us in the studio here on Valley Talk, second half of the show. And Dr. Tim, if it's okay if I call you Dr. Tim?
Absolutely.
What he's going to be talking about is the need to improve our diet and get more exercise, and that's going to go a long, long way to making us healthier, which is the goal for everyone here. So we'll have that conversation with Dr. Tim in just a moment. But I want to, first of all, remind you also to sign up for Quiznos Taste on Us. Speaking of eating healthy, they're a sponsor of Valley Talk here. Send me an email, dave@kgal.com, or call the station at 926-KGAL, 451-KGAL. And at the end of the show, we'll give away a $10 gift certificate for Quiznos Taste on Us. It's the Albany location only. It's right next to Novak's Restaurant, across the parking lot from the former G.I. Joe Sporting Goods location. Quiznos Taste on Us. Thanks to Dale and the crew for being a big part of the Valley Talk family. So, Mike, what we have now is not sustainable. There's a lot of people that agree with that. You hold that opinion as well. But it can be changed, is the message you want people to walk away with.
That's correct. That's correct. I mentioned other countries have done this. 22 other countries have done this for the people, where people do not go bankrupt because of healthcare costs. They do have access to good primary care. They may have to wait for certain types of treatments, but not for essential treatments. And Dr. Hindmarsh can comment further on what other countries do, I'm sure. But we know we can change this system, and it takes all of us telling our legislators what we want. And I did want to mention one story of many that I have come across. One was a patient at the cancer center who had this discussion with his wife, with the kids in the next room. Honey, I have a stage 3 cancer of the head and neck area. They're offering radiation therapy and chemotherapy. I have no guarantee that it will succeed. And if it doesn't, I don't want to leave you without a home and without an income. And he was in the process of deciding against treatment. This kind of dilemma is happening to people every day in this state and in this nation. And we can do better than that. We can make sure everybody has good access to health care.
So essentially what he was saying is, I don't want to incur the medical expense, so in other words, to leave you with a home and resources and financial wherewithal, I'll just die.
That's right. As long as we have a system, healthcare system that's based on healthcare as a commodity, this is still going to happen. Even after the Affordable Care Act and coordinated care organizations are fully implemented. So I'm encouraging people to go to the website, hcao.org, and get involved. Make your legislator do what we need for this country, which is access to primary care and to basic health care.
Mm-hmm. How much money do you think a big part of the answer here is to encourage, I don't want to use the word threaten, but encourage people, and Dr. Tim will be talking to him more about that in a moment, to live a healthier lifestyle, eat better, and get more exercise. I think one of the biggest problems, and Dr. Tim might agree with me, is obesity is a big problem here in the United States. There's lots of, and if you've been listening to the show, you've heard me, you know which example I'm going to use. I was in New Zealand, came back, the first thing I noticed, I even mentioned it to the hairdresser when I got my hair cut this morning. First thing I noticed when I got off the plane in Los Angeles and looked at the people at the Los Angeles airport was and please understand that if you're overweight, this is not a derogatory statement to you at all, but we Americans as a society are obese, and it's not healthy. It isn't. We need to get off the couch. We need to put down the knife and the fork a little bit sooner.
Mm-hmm.
Is that a big part of the problem?
Yes, it is. And I think it's important to have a healthcare system that focuses on educating people. Not all of us have had the privilege of growing up in a home where healthy habits were part of growing up. Many people live in urban areas where fresh fruits and vegetables are not available and they're too expensive. And it's the fast food burgers that are affordable, and that's what people eat. People are depressed when they live in those settings. They smoke. They do things that they can be trained and educated to not do anymore. But much of that depends on access to primary care and to a good public health system. And both of those services are being taken away from us in a system that's market-driven. That's why we need to change that.
But I think a lot of people are hesitant to throw more money at the problem, tax and spend on more health care with the current system we've got. Do you agree that throwing more money at the problem is not an answer?
I agree. Throwing more money at our current system that's based on private health insurance and a market-driven system is not the way to go. It's costing us twice as much as other countries and giving us about half the benefit. If your income is above $159,000 a year, you have access to the best health care in the world in this country. If you're less than that, you may have the worst health care compared to 22 other countries.
Simply because you can't afford it.
Can't afford it.
I'll just use New Zealand as an example once again. When you register your car in New Zealand, you pay part of the registration fee goes into their medical fund. And you can register a car for a day or a year or however long you want to register it. And part of that is into an insurance pool that covers any and all accidents when you get into an accident on a New Zealand roadway. So if you are driving along in a car in New Zealand and you get injured because of an auto accident, you're covered. Everybody on the road is covered because everybody pays into this fund. Is that something you'd like to see here in the United States?
I would. Yes. New Zealand is way ahead of us in terms of making sure everybody has access to health care there.
But they also have some challenges in New Zealand. One of the challenges they have is with the Maori, and they have a lot of health issues, and they've developed both a private system to go along with the social system, because one of the challenges that they're having with the social system is you might need a procedure and you have to wait a long time to get it. And so the people that have the money that don't want to wait 6 months to be treated for cancer or whatever, they can get immediate care now, and so they're developing both systems. Do you think maybe both systems might be an answer here in the United States?
No. I think that the more you develop a two-tier system and wealthy people can afford to have a shorter queue, the less motivated they are to support a system that makes healthcare available for everybody. So there will be services that people will want to pay for, a private room, certain elective surgeries. That's not what we're talking about. What we need is basic care, primary care, preventative care for everybody. And I do not feel that we should do this with a two-tier system.
Okay. Dr. Tim Hindmarsh, welcome to Valley Talk. Glad to have you on the show today.
Thanks for having me.
You've been listening to us. Maybe you were listening to us coming in. So jump into the conversation here. What's your first reaction as you hear us having this discussion?
Well, I have a different view. I mean, I was trained in Canada. I grew up in Canada. My father practiced medicine there for about 40 years. My brother did for about 15. And, socialism doesn't work, and socialized healthcare definitely doesn't work. I mean, I watched my mother-in-law literally stand in line until she died, from a treatable cancer. So, it's nice to say that, a socialized system increases access, but in a lot of respects, it decreases access. And we're going to see that, I'm quite convinced, with the Affordable Care Act. There's no question that we have a lot of tremendously messed up incentives in the American system. There's no question about that, both on the patient and the provider side. But I would disagree that this is a market-driven system, because it really isn't a market-driven system.
It is not a market-driven system?
No, it's not. It's a protected market-driven system. In other words, there's elements of the market that are of the healthcare market that really is driven by the market, but it's not a free market, and it's very different. I'll give you an example. There's a medication called Provenge that has been approved by the FDA and is covered by Medicare. Okay, and then I've researched this drug a fair bit. I learned about it on one of the committees I sit on with Samaritan, and now I can't watch a basketball game or ESPN without it being advertised. It's a very interesting drug, and it's used in end-stage prostate cancer. And the official FDA indication is castrate-insensitive end-stage prostate cancer. So they have done everything to save your life, okay, including, neutering you, okay, and you still have prostate cancer. But you can get Provenge, and you can get it covered on the public dollar, okay? What they don't tell you is that what it's been proven to do is extend your life by 3, if not 4 months. Now, this is extending your life. You're still dying of cancer. So in a sense, it's extending the dying process. It's another way of looking at it. The other thing they don't tell you in the advertisement is it's $93,000 to do that. And that's covered by public money. And so in a true market, in a free market, if you're an elderly male who are the primary people that get prostate cancer, and you're going to be offered this drug for $93,000 in a true free market, who would accept that? For essentially no increase in life, no increase in essentially no increase in quality of life, why would you pay for that? You wouldn't. In a free market system, it would go away. But we don't have a free market system. It's protected because someone else is paying for it. So you go in, look at the incentive structure. You go in, the urologist makes money off of prescribing the medication. The drug company makes money off of prescribing the medication. The patient is kind of sold this almost quasi-false belief that there's always something to do in cancer, because there is. Unfortunately, in solid tumors, if you don't cure them surgically, there's very little to add, with chemo and radiation. especially as far as quality time, but we do it because someone else is paying for it. So, access is an issue, but there has to be a way where we engage personal responsibility, which is kind of my passion, as well as, the good elements of the free market system, because it isn't a free market. If it was, a lot of this stuff wouldn't exist, because in my opinion, it shouldn't.
How much money would we save, and is it such a big deal in the United States with personal responsibility, eating healthier, getting more exercise? Back to the New Zealand example. Sorry to keep bringing this up, but they're very, very active over there. They walk a lot, eat smaller portions, and other than skin cancer is epidemic over there because of a problem they have in the ozone layer. The kids have to wear floppy hats as part of the school uniform because it's off the charts. But other forms of cancer aren't as high as they are here in the United States. So, Doctor, I've got a question for you as far as if we take more responsibility for our health here, get more exercise, eat better, is that enough to save the system, or do we still need to make some other changes?
Well, I think we need to make some other changes. I think your previous guest and I would agree. I mean, there is a lot of really crazy incentives in the system, and from a financial perspective in the healthcare system, you really do have to change the incentives. Would it save the system? I mean, I don't know. I mean, there's so many other huge fiscal crises in this country that I mean, it's just almost unknowable to try to make that. But for me, it's more than that. It's more than just saving the system. It's saving yourself. I mean, I know what it's like to miss, when I get a cold and I miss a week or I miss 2 weeks of running. I know what I feel like. And it's not just that you're going to live longer. It's not just that you're going to be less sick. And all of these things are true. I mean, there's no question. Exercise is the single most potent, intervention that you can make over the largest group of health parameters, depression, cancer, heart disease, stroke. I mean, all these big killers. Yet, I don't get paid to counsel people to exercise. I get paid to give them pills. And actually, the quality of my health care, especially in diabetics, gets measured partially by how many pills I give them. And so, yet, I've seen, not as many people as I'd like, but I've seen, several patients where I've engaged them and challenged them, and they figured out that, they have a goal, and so they lose weight, and all of a sudden, all their pills go away. But more importantly, they have a life again.
Right. So we need to get more towards a performance or results-driven matrix than selling pills. Don't you agree?
Yeah, I think so. But and then you get into the bizarre debate about how do you measure results, and the fact is that health. I honestly don't really like the word healthcare, to be perfectly honest with you.
What do you want? What would you like to call it?
Well, I mean, healthcare is self-care, and I don't think that. I really don't think that primary care doctors should be doing much prevention. I hate the word preventive medicine. I think it's an oxymoronic statement because medicine isn't used to prevent things. Medicine is used to treat diseases. I'm not trained. I haven't been trained to, be a life coach. I have been trained to diagnose and treat disease. And, the fact is that when you have a ruptured appendix or when you have, a treatable form of cancer or a pneumonia, you don't want to go to a life coach. You want to go to a doctor. You want to go to somebody who has that specific training to be able to save your life. And so, I think that there's a lot, and I know with the new CCO model that's coming in now, and what Samaritan has been engaged is, I think that there are some tremendous opportunities in there to be able to say, look, there's people that you don't have to pay $100 or $200 or $300 an hour to be able to help engage people in very simple, very economical things like how much do you eat, how big a plate should you have, and are you exercising? The national recommendations for exercise are not complicated. It's 150 minutes a week of moderate intensity exercise, which really comes down to walking half an hour a day, 5 days a week. If I could get people to just start there, then once people feel a little bit better because they're exercising, then they want to change their diet. Then, they walk with a group of friends and their relationships get better. And all these things that are what I would call real healthcare get much better, but they're very inexpensive.
You're pretty passionate about that, aren't you?
I am.
In fact, you've got a talk coming up. Go ahead and mention it now.
Yeah, I'm going to be doing a half-day seminar at the church I attend, The Shift, which is 35355 Iker Road, Albany, on May 11th from 9 till noon. It's free. And I call it Training to Live. And basically, I go through the premise of this talk is going to be, why should you take care of yourself? And what are the risks of not doing that? And then really, what I think is really missing, and what I've found in my own life and in the lives of my patients when I've engaged them with this, is how do you do it? How do you start an exercise program? How do you approach a dietary program that's based, really on motivation? I have a website, extrememd.com, and the byline of that website is motivation before medication, because really when people get and stay motivated, and they do that for about 6 months, then they can't go without it. This isn't about six-pack abs and all the stuff you see on TV. This is about half an hour of walking 5 days a week to start with, and then taking it from there.
As you look at the number of patients and the outcomes and where they are currently in their prognosis and state of health, kind of the state of the union as far as their health is concerned, when you look at these patients, are you seeing a number of patients and you look at them and think, boy, this person probably wouldn't be in this situation if they took better care of themselves with health, with the exercise, and with diet? Is there a fair number of patients that you look at them and say, you probably, maybe you don't tell it to them, but based on your experience as a doctor, that if they had taken better care of themselves, they may not be in the situation they are now?
Yeah, I'm an urgent care doctor now. When I was doing primary care, which I've done for about 20 years, that was the majority of patients. Because, we've moved primary care largely just because of the nature of demographics and so forth to, chronic disease management, which is really tough. That's a really hard job to do. But so much of chronic disease in an affluent country like the United States are illnesses that essentially, we kind of precipitated ourselves.
Interesting. This is Valley Talk, and we need to take a break. We're running a little bit behind, and we will continue the conversation with Dr. Tim Hindmarsh and Mike Huntington of Healthcare for all of Oregon in just a minute. We'll be right back.
The Osgood File, sponsored in part by LiftMaster Garage Door Openers. Use your smartphone to open or close your garage door anytime from anywhere. This is Charles Osgood. One of the most destructive invasive species on Earth has taken up residence in South Florida, as our CBS News colleague Mark Strassman.
They're giant African land snails. Adults grow shells as long as 8 inches, and what they do best is eat, and eat, and eat.
And what do they eat?
They feed on 500 types of plants, and pretty much every fruit and vegetable grown around here. But they also chew right into people's homes.
They chew into your home, there goes the neighborhood, as you'll hear after this. There's an old saying, expect the unexpected. Wise words, like suddenly remembering you left your garage door open when you're halfway to work. With a LiftMaster garage door opener with MyQ technology, you can use your smartphone or computer to control your garage door from anywhere, anytime. And LiftMaster garage door openers with battery backup keep your garage door working even if the power isn't. So be prepared for the unexpected. Learn more and find a dealer near you at liftmaster.com.
Does your business thrive by serving other businesses? Would you like a healthy, steady flow of B2B leads that are customized to grow sales? Hoovers has developed a best-in-class lead generation tool that makes it easy for you to find targeted leads for your business. You'll be amazed at how easy it is to get the right leads fast. Try it today for free. Get 50 free leads and a 24-hour trial. Just call 800-601-7780. 800-601-7780. 800-601-7780.
Yes, you heard right about these giant African land snails eating houses. The owners of Florida stucco houses could become the stuckees.
The first 6 months of their lives, they primarily are going after stucco, concrete-type things to get the calcium to build their shells strong and bigger.
Mark Strassman, I'm guessing the giant African land snails come from Africa.
The snails got here from East Africa. No one's sure exactly how. They've made a buffet of parts of Asia, the Pacific, and the Caribbean. South Florida could be next.
The Florida Agriculture Department is used to having invasive species. Spokesman Mark Fagan.
We average one new pest a month in the state of Florida. Now, not every pest creates a huge problem like the giant African land snail. In this case, there is no natural predator for the giant African land snail except us.
They've dealt with these critters before, Strassman tells us.
Back in the 1960s, a young Florida boy brought home 3 of these giant snails from Hawaii to keep as pets. It took 9 years and $1 million to get rid of 18,000 snails. This latest infestation started a year and a half ago. 50 inspectors have already captured 120,000 snails.
The Osgood File. Charles Osgood on the CBS Radio Network.
The Boys and Girls Club of the Greater San Am supports 3,000 kids a year. Yee! Engaged in high-impact programs, and your support is needed to keep these programs going. So help us out by cowboying up for kids at the Wild West Auction, Saturday, May 4th, at the Lebanon Elks Lodge. Silent auction at 4 p.m., dinner at 6, and the live auction starts at 7:30. Whether you can get there or not, call 541-258-7105 for more information on how you can support the Boys and Girls Club of the Greater San Am and the youth of Lebanon and Sweet Home.
Jim Twitchell's the senior master technician at Ford, and once he starts talking brakes, there's no stopping him.
Brakes are the most important system on your car as far as I'm concerned. And when we do an inspection, we check the pads and shoes for thicknesses. We check
Motorcraft brake pads installed $99.95 or less. After $50 in mail-in rebates when you use the Ford Service credit card, just $49.95 or less. Taxes extra. Rebate by check subject to credit approval. Pads or shoes on most cars and light trucks. 1 axle. Excludes machining rotors or drums. See participating Ford dealer for rebate details through 5/31/13.
Discover card.
So that's it, I lost my job. My days of coaching football are over.
Well, that's tough, but you will bounce back. You've got our new IT card that will lower your interest rate, lower your monthly payment, or find another way to help.
You'd do that for me?
Of course. You are a champion. Now, who are you?
A champion.
No, come on. Who are you?
A champion.
Who are you?
I'm a champion.
No, seriously, I need your name.
Oh, it's Steve.
At Discover, we treat you like you'd treat you. Job loss support. Get the new IT card at discover.com.
The Car Show, Saturday afternoons on News Talk 1580, KGAL.
Welcome back to Valley Talk. 11:52 is the time. In the studios today, Mike Huntington with Healthcare for All of Oregon and Dr. Tim Hindmarsh, a practicing physician for about 20 years.
Correct.
Thank you for being on the show. Mike, we want to clear up something about how you're affiliated with Healthcare for All of Oregon. How are you affiliated with the organization? Do you speak on their behalf, or how does that work?
No, thanks. I'm a member of Healthcare for All Oregon, but not speaking on their behalf. I'm also a member of Physicians for a National Health Program. Passionate about both of their causes, but not speaking for them.
You've heard Dr. Tim talk about some issues here. Your response and what you've heard in the last 10, 15 minutes.
Yes, I agree with almost all of what Dr. Hindmarsh said, especially putting physicians in a role of dispensing medication and not reimbursing them for the more valuable part of training people how to live healthier lives. I disagree, even though he's from Canada, I disagree a little bit about the system that they have there. They do provide better care for their people at less cost, about half, compared to this country. And it's not because their national system tells their doctors what to do. Healthcare is a local service, and they make it local. They make local decisions in Canada. They just do a better job of it. And I want to remind everybody that nobody goes broke in Canada because they don't have health care. There are waiting lines for elective process, but not for emergencies.
Dr. Tim, do you want to, I don't want to create a debate here, but...
No, and I think debate's really healthy, but, the fact is that, it depends what you want, and the problem is that, Canadians and Americans are really different.
Eh?
And it's an amazing thing, and you really have to live in both countries to see it. It's subtle.
Yeah.
Now, Canada has a very similar demographic mix to the United States. I mean, it's largely immigrants. It's immigrants from a whole different, raft of different places. But their obesity rate is about the same as what the U.S. rate was in 1965, which was the year I was born. And, it takes me a while to get out of bed now compared to it did, years ago. So that was a long time ago. Canadians are significantly more active. And so there's these cultural differences, and really, when you get to, we have a rate of obesity, and if you combine overweight and obesity, the rate in the United States is 70%. I mean, that's a cultural problem. It's not a healthcare problem. And where I would disagree with Mike is that, you could say that they take better care of people in Canada because certain indices are better, and there's no question they are, but that's because they have a different culture. So when people are much less overweight, when they're more active, et cetera, they smoke more in Canada, which is amazing, yet their health indices are better.
Interesting.
Japan, they smoke almost 10 times more than they do in the United States, and their health indices are better, but their obesity rate is about 10% of what it is in the United States. And so I guess what I'm trying to say is that, we put a lot of stuff on healthcare. We say, the healthcare system is making these people in Sweden and Canada and Japan better. And I would disagree. I would say, no, it's their culture. It's a more healthy culture. I mean, if you eat more fish like they do in Japan and you walk everywhere, then you're going to be healthier. And all of those downstream indices like cancer and at what age people get a stroke or heart disease, I mean, that all changes. And so the thing that kind of scares me is that, healthcare is so powerful that we're going to pump all of this money into it because it's going to do all of these great things. I mean, you could make an argument that reducing access to healthcare may be why they have better health indices in Canada, because they do less fancy stuff. I mean, we spend more money on healthcare in the United States, not just because it's a little bit more expensive, but because we consume way more healthcare. We get way more stuff done to us.
We're running a little bit behind on breaks. We need to take one more break. We'll be right back.
Steve
Holy brings his pop country sound live in concert to the Lake County Fairgrounds, Saturday, July 20th.
Good morning, beautiful.
Concert is free with your general admission ticket. Limited reserve seating is just $15.
Mine was wonderful. I got a brand new girlfriend.
Steve Holy. Go online to lincountyfair.com to purchase your tickets today.
Got to LA for the weekend.
American Legion Post 10 in Albany is opening their doors to the brand new American Legion Hall on May 1st at 1215 Pacific Boulevard. With a grand opening ceremony scheduled for Flag Day, Friday, June 14th, American Legion Post 10 is publishing a magazine dedicated to the history of their service to veterans, service members in the community since 1919. You're invited to share your story of a friend or loved one in the armed forces, past or present, for this tribute magazine. Call 541-401-1063 and submit your article. The American Legion Post 10, Oregon's largest American Legion for 97 years.
How would you rather spend your free time? Working in your yard or enjoying your yard? If you'd rather spend your free time having fun with family and friends in a beautifully landscaped yard, just call Doug Burton Landscaping. Much more than just lawn mowing, Doug Burton provides year-round complete landscaping service for your home or business. Call Doug Burton at 791-8758 or click on his link at kgal.com or kshow.net. Doug Burton Landscaping. Call 791-8758.
Cascade West Senior Services Foundation is back again with the Live Well, Age Well Health Expo, Saturday, May 18th from 9 to 3. Free admission, free health screening, medication consultants resources at the Lynn County Fair and Expo Center. If your business would like to participate, booth space is still available. Log on to agingwellexpo.org or call Jill Ingalls at 541-497-7481. Booths are on a first-come, first-pay basis. Space is limited, so call now. Special price on nonprofits.
Learn how to stay healthy after 50 at the Live Well, Age Well Health Expo.
There are 3 big reasons why now is the time to buy a piano at Gracewinds Music in Corvallis. Number 1, an out-of-business piano store has sold Gracewinds its entire inventory of pianos at a discount. Number 2, these pianos were all purchased prior to recent price increases. And the 3rd reason is spring rebates. Save like never before on new and used acoustic pianos from Kawai, Yamaha, Korg, Windsor, and more. Pianos starting at under $1,000. Hurry, the sale ends April 30th. Gracewinds Music, where musicians shop and new talent begins on 3rd Street, downtown Corvallis. Family owned and operated since 1985.
They are called the world's greatest generation. Because of their sacrifice, we are free today. The movie Honor Flight, One Last Mission shares that story.
We will never, ever forget.
Honor Flight, One Last Mission, with 2 Saturday 1 p.m. showings in the Willamette Valley. May 18th, Albany's Pix Theater, and May 25th at the River Center in Lebanon. Tickets are $10 each, all proceeds helping to send Willamette Valley...
Serving the Mid-Valley for over 50 years. You're listening to News Talk 1580 KGAL, Lebanon, Albany, Corvallis.